Hi everyone, Monica Moore here from RMA of Connecticut, one of the nurse practitioners. On this edition of Ask Monica, we are going to talk about does age, or how does age really impact fertility? And in order to talk about this, we're going to use the whiteboard here and discuss why we care about age, why age matters, what is going on in the body that really affects age. So if we look at a cell, we look at two parts, the cytoplasm and the nucleus. And in the cytoplasm are structures. One is called the mitochondria, and it is the energy provider, so to speak, of the cell. So cell division is very hard work. We know this when we study and we look at the amount of energy, or ATP, that needs to be produced in order for cell division and proper cell division to take place. So the mitochondria is the energy, or ATP, producer of the cell. As a cell ages, so do all the structures in the cytoplasm, including the mitochondria. So as the mitochondria ages and it's the energy provider for cell division, we can expect then that as the energy provider, cell division may be negatively impacted. There's also other structures there. In some studies, CoQ10, a supplement, has been shown to be sort of spinach or positively affecting the mitochondria. So we have you take CoQ10 in order to kind of combat this normal aging process. The other structure is the nucleus, and the nucleus is what contains the chromosomes. Here we have a female, it would be 46 XX chromosomes. And what happens with chromosomes, is that there's cell division of sex cells is something called meiosis. And meiosis, women are born with all of the eggs that they're ever going to have. And what happens is, before we're born, meiosis is what's called arrested or paused in a certain cell state. So as you age, and then the green light for meiosis, so the resumption of meiosis, is ovulation, or if we give you medications, an LH surge given by medications such as Avidril, HCG. So if you're 35 and that particular cohort of eggs that you recruit is 35 years old, it has been arrested or paused in meiosis for 35 years. So that means it has to basically kind of wake up, dust itself off, and resume cell division when it's been kind of stuck in this particular part of meiosis for that long. You can imagine then that if the chromosomes in the nucleus have been kind of paused for a long time, and then the producer of energy is aging, that cell division might be what's called inefficient. So if we have a cell and there's meiosis, what we would see is when there's a splitting of the cell, one chromosome goes here, one chromosome goes there. But what could happen is instead no chromosomes could go here, both chromosomes could go there. This would result in, once it meets with sperm, this would result in a trisomy, or 3 chromosomes. Once this meets with sperm, this would result in something called a monosomy. And both of these are what's called aneuploidy, or having an abnormal number of chromosomes, which usually is incompatible with life and can cause recurrent implantation failure or pregnancy loss. So what we see is that in our research is that fertility potential declines, and the percent for recurrent implantation failure, so not getting pregnant on a cycle, or pregnancy loss, really goes up between the ages starting at 35. And that's why when we talk to you about being aggressive with cycles, what your treatment cycle is, we really take into account your age, as well as all of the testing that we've done for you that looks at your ovaries and what's called your ovarian reserve, or the quality and quantity of oocytes that you have. So I hope this is helpful. We may need to do a follow-up study with better art on this, but feel free to continue to ask us all of your questions and concerns on this platform. Thanks so much.